As state officials work to strengthen COVID-19 testing in Vermont schools, some are concerned it is asking too much of staffers who already have a lot to juggle. Local 22's Devin Bates was at Governor Phil Scott's briefing today, and he joins us now live in the newsroom with more about some of the pushback. Devin?
That's right, Lauren. The goal here is to keep kids in school, but it'll require a much more robust testing infrastructure. Now, we know districts have been given the resources to do it. The issue, however, comes down to personnel. New testing options will soon be coming to Vermont schools. By the end of the month, rapid testing, response testing, take-home, and surveillance testing will be available. The goal is to keep classrooms open, but can schools keep up?
Major bottleneck for implementing testing will be staffing. I expect many schools will consider hiring additional staff or redeploying staff they already have on hand.
But neither of those suggestions are sitting very well with the Vermont NEA.
That suggestion that you can repurpose some folks from education to this it does not accurately reflect what's going on in our schools. There just aren't enough folks and enough hours in the day to do everything that's expected of them.
It's a question Secretary French and Governor Phil Scott were posed at Tuesday's briefing. If schools were already having a hard time finding para-educators, school bus drivers, and other support staff, how can they be expected to fill these jobs too?
We're all going to have to dig deep in some respects to get through it, as every sector has tried to do.
My conclusion is that there needs to be a priority on testing because it accomplishes both our educational goals and our health goals. So I think we're going to have to figure that out. Just working with what we have to a certain extent.
Governor Scott was asked if it's possible that staffing help could be brought in via the Vermont National Guard, but that also brings about some workforce challenges.
We are still using the Guard in some of our vaccination clinics. If we ask for more Guard people, it really impacts other areas, other sectors. It's a civilian military, so we'd be calling them into active duty and taking them away from their other day job.
Now, some other updates from today's briefing. About 15,000 Vermonters have now received a booster shot of the Pfizer vaccine. And when it comes to COVID cases, we are seeing some improvement over the past 7 days. Vermont's case rate is down 15%, and it's down 23% over the past 2 weeks. Live in the newsroom, Devin Bates, Local 22 News.
A closer look at the numbers, Devin. 91 new cases in Vermont today, 33 of those in Rutland County, 37 people currently hospitalized with 13 in the ICU. 361 new positives in New Hampshire with 3 additional deaths. And the state announced more cases from Friday, boosting county numbers. So here we go, 31 in Grafton, 25 in Coos, 19 in Sullivan. In the North Country, Franklin County reporting 26 new cases, 18 in Clinton. No new updates right now out of Essex County.